Good day, everyone, and welcome to today's webinar entitled Clinical Retention is a Digital Transformation Issue. My name is Mark Hagland, and I'm Editor-in-Chief of Healthcare Innovation. Today's program is sponsored by ServiceNow. Thanks so much to our friends at ServiceNow and to you in our audience for giving us your time and attention today. Before we get started, I have just a few housekeeping details to share with you. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. Now, it's my pleasure to introduce our two speakers for today. Vishakha Sant, who is Global Head of Healthcare Provider Industry Solutions at ServiceNow, and Erin Smithouser, who is an enterprise architect and a registered nurse at ServiceNow. They are going to discuss ways that organizations can return clinicians to focusing on patients and patient care and have technology work on administrative and orchestration work. So it's my pleasure to welcome you both. And with that, the floor is yours, Vishakha and Erin. Welcome.
Thank you. Thank you so much, Mark. So thanks everybody for joining, and Healthcare Innovation for giving us the platform to have a voice here as well. I'd like to provide a little bit background on myself. Vishakha Sant. I lead the healthcare, life sciences, and payer space for ServiceNow. I have experience prior to this with Kaiser Permanente, Baylor Scott & White, Texas Health Resources, where I've pretty much dedicated my life to this intersection of healthcare technology, patient engagement, clinician enablement, and making sure that, you know, I do my part in terms of trying to fix this big challenge that we all have, which is, you know, healthcare. Erin Smithouser here. She is a little bit of a unicorn. She's probably one of my favorite people at ServiceNow. She's an enterprise architect and a registered nurse, has had more than 20 years of experience in healthcare IT, working for McKesson, Johnson & Johnson, Pega Healthcare. And so, you know, really looking forward to having this dialogue with you all. And just a few things that we want to just go over, right? We are going to be focusing on this notion of clinicians and this notion of reducing burnout. How do we actually design processes more intelligently so that it's an enabler of value-based outcomes rather than something that actually creates friction internally or with patients. And the use of technology shouldn't be a hindrance. It should actually be very much of a seamless experience. So, you know, our frontline workers, unsung superheroes, right? They're under pressure to provide better, faster, more personalized care to patients. We worked with Healthcare Innovation to actually conduct a survey. You will be seeing some of the results of that survey. We will also talk about some of the solutions to what we see in the survey so that you can take that back to your organizations and try to help move this forward, this dialogue forward beyond this webinar and into your organizations as change agents to make sure that we are doing what we can to fix the problems that are in front of us and that will continue to be. So with that, Erin, thank you for joining ServiceNow. And I personally want to know, you know, why did you leave healthcare?
Well, it's a pleasure to work with you, Vishakha. Welcome, everyone. And that's a great question. So yes, I am the statistic. I left nursing in 2018 before the pandemic. After 10 years at the bedside as an ICU and transport nurse, as well as being an assistant manager and a hospital supervisor. So I've seen the direct care setting from all levels. But even before the pandemic, the administrative burden on healthcare was taking over. The amount of time we were pulled away from the bedside to do manual, non-clinical activities and documentation became overwhelming. And it started to become unsafe for my license. There just wasn't time to deliver good, fully present care, which is what I love to do. There were also some family reasons, but these work challenges were incredibly distressing. And it wasn't, it was a common theme between nurses at the end of shifts my last year to say repeatedly, it doesn't need to be this hard.
Yeah, I empathize with you, and honestly, I think nurses are just a special breed of people, clinicians in general, but the nurses, they're just, I feel like they really carry things forward. And I guess in terms of like, this doesn't need to be so hard. While it doesn't need to be hard, like the landscape of healthcare from a regulatory standpoint actually makes it a little bit harder, right? Because of all of these time-consuming practices that actually take the valuable time away from patient care. There's notions of prior authorization reform from the Biden administration. It's great, it's working towards improving prior authorization processes, but then there's also a lot of documentation that's trying to get electronic, and getting to that point of actually the change, that can sometimes be a little bit stifling. And then you have, Medicare, Medicaid. I mean, healthcare, after all, patients are definitely at the core of it, but then it's a business also, right? And so Medicare, Medicaid, these reimbursement systems and the challenges of proper documentation, meeting reimbursement criteria, making sure there's attention to detail. I read a stat about the AMA actually conducted a survey in 2019 that found that physicians actually spent an average of 15 hours per week on administrative tasks related to Medicare and Medicaid. Yeah. And you cannot avoid that, right? Usability from the standpoint of just technology systems and healthcare settings, it can be pretty poor. Some of these systems are very archaic, but there also been a very large investment for the healthcare system, and you can't just rip and replace. So you're living in this legacy world, you're trying to be more innovative, and there's a lot of friction there as well. And then from the standpoint of, the administration and some of the policy changes, I think that they're trying to get to a point of like interoperability with this patient access and final rule that was in 2020, which requires healthcare organizations to facilitate the exchange of information and not have the information blocking. But then what that's done is it's stressed out the IT infrastructure and the systems to try to be able to create those tunnels of exchange that are needed in order to actually allow for different stakeholders to get access to the information they want, but at the same time, put patients in control of signing off on who has consent for that information. So, what do you see, Erin, in terms of like these administrative challenges? I'd love to get your thoughts on some of the burdens that you faced, our Frontline is facing as it relates to some of these regulations as well.
Absolutely. Great points. So 25% of all healthcare expenses in the US are the result of administrative work. I love to call administrative work the unnecessary tax we put on doing the essential things in the most ineffective way. These include calling, paging, faxing, coordinating schedules, making appointments for patients, tracking down documentation, filling out manual forms, trying to find devices, pumps, monitors, beds, all when you need them the most. This manual work is frustrating to all health system workers, and it's expensive to the organization as well. Administrative activities equate, I think last year, to over $60 billion for healthcare organizations in the US. We can fix this with intelligent, easy to use connected systems. Vishakha, what are you seeing from a global perspective? Are there some similar challenges?
Yes, I think that healthcare, while people have the sentiment of, socialized care, private care, it's very different across, it's really not, right? I mean, the US has one of the biggest social care plans, the VA, as well as Medicare, Medicaid, right? And so parts of it, yes, we do have a public system, and then we do offer private insurance as well. As I work with organizations across the globe, they are all strapped with the same challenges, right? And some of those things are, you have to innovate, but you have to do more with less. You have to provide the access, but you have to do it anytime and anywhere. And oh, by the way, like it should be at the convenience of the patient now. And so, it's one of those things where they're also trying to fix things like health equity, right? How do you get into aged care reform, social care reform, and the whole notion of like bridging the digital divide? Not every single demographic is welcoming the notion of digital for ease of use, right? So how do you augment some of these technologies to actually still be in the preference of a person that might still want to have all of the paper to read and mark up on? And so I think what we're really facing across the board is this era of, we know healthcare needs to change. The pandemic forced a change, and now we have actually, taken strides forward. I think some of the things that are challenging across the globe is worker shortages, right? The World Health Organization estimates that there's a global shortage of about 4.3 million physicians and nurses and other healthcare professionals, and it's only going to continue to grow. So as we face this challenge between the demand for healthcare, as baby boomers are now aging into these complex care conditions, but then you have this, supply side, which is we don't have the same level of clinicians to put forth. And then on top of that, academic institutions for, clinician and physician programs are seeing a decrease in enrollment. Absolutely. The pandemic stressed people out, right? And so I think that across the board, while they're trying to do things like in NHS having paperless 2020 to reduce the amount of paper, or in Australia, my health record system to give patients a way to actually access, what we've done here in the States, or like GDPR in the European Union, where you have to consent and there's security protocols, it's actually stressing out the healthcare system. And, some of those challenges, I think, is what we saw in this report that we did with Healthcare Innovation in the collaboration between February and March. Just any thoughts on that before we kind of jump to that report, Erin?
No, it makes sense. This is not just a U.S. problem, right? It's a healthcare problem.
Absolutely. So here we see, a report where when we asked what challenges frontline healthcare workers face on a daily basis, you see the greatest challenge, which I just want to point out, the bar is not there, but it's lack of resources. It was 70.73%. And then you see some of these other kind of general IT, 50%, too much time doing clinical documentation. And we'll get into some of that, about 50%, right? And I just want to get a sense from you. You can see some of the others here. A lack of resources, human capital, it seems like it's the biggest challenge for frontline workers. Erin, like from your perspective, do these numbers resonate with what you've seen in the past and what you see as you work with healthcare organizations today?
Absolutely. That number looks very accurate considering what makes up that bucket of resources in direct care environments. So resources are secondary to what clinicians do. Resources are what clinicians use to get their jobs done. So primarily clinicians are there to assess, diagnose, treat, and evaluate and deliver care to help heal their patients. So this indicates that they don't have the tools to serve the patient in the best way, which is very scary. There's incredible pressure on healthcare workers today with not having the resources they need, whether it be human assistance or supplies, it could be equipment, devices, it could be content, timely content, or even training. Vishakha, what are your thoughts on this finding?
I think there's several aspects of it, right? When we talk about that supply demand, the thing that kind of jumps out at me is this notion of time spent on onboarding, orienting, precepting, mentoring. It's huge, right? For 50% of time spent on doing those things, and you have to be effective in that because the time you put into investing in how to do that properly ensures that that person is not going to leave. And there's this other stat, I think, Erin, you told me about this, about 52% of first-year nurses quit because they haven't had the best experience, and it's challenging for them. And so, clinicians orienting them to the organization, and now with this large increase in travel nurses, like, how do you continue to maintain that accountability in the sense of, this is a culture that I'm a part of, even though I'm on contract, and how do you make them a part of it? There was this essence of, at Kaiser, they used to call it, the joy of medicine. And there's this notion of, like, what happens on those floors when you're so close together, and really making sure that you can continue to offer that joy in medicine to your clinicians and your physicians. I think, those are some of the things that this is all about. The other number, while it's very low, is the notion of, locating assets, about 12%. So if you think about it, right, if a nurse is on a 12-hour shift and 12% of the time they're trying to find assets, that's like 72 minutes per shift that they're looking for stuff. And, we wanted to understand that a little bit more. And so we kind of dug deeper into that, and we looked at, next slide here, in terms of how many hours clinicians spend tracking down devices. And 63% of respondents said they spend more than an hour a day. I mean, this is individual people, more than an hour a day tracking down a device or some data or some information. And then 23% said they spend more than, 1 hour a day, and up to 2 to 3. 27% said they spend more than 2 to 3 hours a day looking for
That's
things
amazing.
like, right? I mean, in this day and age of AI, real-time location services, and the ability to, track your kid if they go out, but I can't track a device that might be like in the next room. It's quite eye-opening about, how much adoption and hesitancy there is to adopt some of these technologies, although they can actually improve some of these stats. I was actually pretty surprised about some of these numbers. To me, I felt like they seemed exaggerated. I'd love to get your point of view, Erin.
Not at all. I've spent entire shifts looking for beds throughout a hospital, especially in croup season, right? When all your little pediatric croup kids come in, but they only come in the spring for about 4 weeks. So where we put those beds in the hospital, it's anyone's guess. But I remember it well. Two things: sifting through content. We called it content chaos, because you had out-of-date policies that were in binders, and some were in folders, and some were on the intranet. But some on the intranet were for ICU versus the ER versus transport versus med-surg. And running what we call the device gauntlet, right? Spending those hours and days and shifts trying to find what I needed for a critical patient's care. The time wasters were incredible job dissatisfaction point, especially when you consider, you go home and you have this easy to use mobile ready experience that we naturally have in our personal lives, so the disconnect is just astounding. So let's see, let's dig a little deeper. Now let's talk about the biggest frustrations experienced by clinicians in the report. Let's see, so 3 of the biggest frustrations experienced by the respondents' teams or coworkers. Number 1, again, limited resources. Resources are key, and we already walked through that pretty well. Number 2 was flow of communication between team members at 40%. That's substantial. And EHR, electronic health record challenges, almost at 40%. And then we'll look at the one underneath that. Oh, this one's good too. Not receiving relevant information that would help me provide better care. And I think this is the one that really weighs on nurses and clinicians, right? They're there to deliver the best care. They're not there, to make exorbitant amounts of money. They felt a calling and a passion to deliver the best care every shift to their patients. And when they don't have those systems and realize after the fact that, something could have been quicker, delivered quicker. Some medicine could have been more effective if we had had the records. That weighs on the clinician. That's really hard to take forward. There's no surprises for me here in the data. These disconnected communication systems, they weigh heavily on patient care and patient providers. I've seen the simplest tasks take the longest. Can I get in touch with a surgeon about a new finding from a patient? Or how do I get my patient's record that just transferred into another facility? Or where do I find the policy on starting an IV line for a neonate as a float nurse? There's a terrific opportunity here to digitally transform the operations and the workflow around the processes of delivering care, and it's time. Vishakha, what are your thoughts here on this one?
Yeah, I mean, some of those things like, the IV line or the neonate like procedures as a float nurse, like all of those things shouldn't have to live like on an intranet somewhere where now the clinician is having to get out of the EMR to actually go do something. I feel like it should just really be in line with their work. And, for example, like when I see this stat about electronic health record challenges, I read a study by Mayo Clinic where they actually compared the EHR system usability to everyday products. So for example, like Google search or an ATM machine or Microsoft Excel. And they actually concluded that, there's an association between the perceived EHR usability and professional burnout amongst US physicians, because it's not the best user experience. And if you want a better user experience, there's a lot of configuration that has to happen, and your organization doesn't have the dollars to go into better user experiences. So you're in this vicious cycle. But what I found really interesting was they concluded that across the spectrum, the EHR systems received a grade F on a scale of A to F, where things like, Google search was an A, the ATM machine was like a B, Microsoft Excel was like an E. And I kind of agree there. But, when you evaluate that against a standard metric of technology use, it is increasing to this notion of burnout. The other aspect of this is like receiving information. It's not that there's not information out there. There's plenty of information on a patient, on their family, on the conditions, on outcomes, on the treatment plans. It's really about how do you get it out of a specific system and put it in a way so that you have good clinical decision making, or you are able to couple that with something like a claim system so you can see, do I have repeat offenders in my ER that always go home with non-acute conditions? Is there a way for us to try to limit the use of that by having some sort of tailored campaigns for that person? That type of information literally does need to be brought onto a platform so that you can make those correlations. Budgets, honestly, can't do much about budgets, right? Budgets are kind of set. There's operating margins that are razor thin right now. But you can also look at things like, instead of, the return on investment, the value of the investment. How, over time, what are some of those things that are strategic goals and objectives that will help your organization get to a moving forward? General IT challenges, I always joked around previously about like, if it's touching a computer device, something, it just goes to IT, right? And in reality, it's much more complex than that. So the general IT challenges, would love to hear in chat, it's just breaking that down a little bit more. And if these things resonate with everyone, and if these are the challenges that you are experiencing within your organizations as well. And the big one that came up, the supply chain operations, that is all COVID, right? Prior to, yes, there were hiccups in it, but I feel like COVID absolutely exasperated this notion of it. So, I think that we've kind of set the groundwork for what we're seeing at a macro level. We've set the groundwork for what the survey says in terms of just some of these challenges, and would love to hear your thoughts in chat in terms of, do they resonate with you? And then what I'd like to do a little bit is Erin and I are going to flip a little bit to the next slide in terms of, what can organizations do to resolve the whole notion of time management, right? How do we actually alleviate some of the pain that our clinicians feel? And again, this came from all of the clinicians that actually took the survey, but this notion of we're going to actually deep dive into each of these and provide some solutions and ways and use cases that this has been proved out previously, so that you can take this back to your organizations and kind of figure out where do you feel like would be value add to your organizations as well. So like the first one, streamline processes and workflows, 71.7%, right? I think that that is one of the biggest ones that we've seen out there. The ability to automate more manual processes at 57%, decrease the number of systems interacted with about 53%, right? There's a lot of different systems. Erin, I'd love to get your perspective on like streamlining processes and workflows. That seems, so vague. Can you just elaborate on that a little bit?
Absolutely. And I love that we transition to solutions, right? It's easy to tell a drowning person how deep the ocean is, but it's another thing to help solve the problem. Okay, so I'm going to put my architect hat on for a little bit. We're going to talk about streamlining workflows and processes. But in order to do that effectively, we need to talk a little bit about what ServiceNow is and does, because our entire purpose is to streamline work and processes digitally. So how do we do this? We deliver simplified experiences that empower everyone inside and outside your organization, such as employees, clinicians, patients, folks in your extended network, suppliers, anyone, through a simplified layer of engagement that unifies data from every system across your organization. And through an intuitive and intelligent user interface, whether it be the portal or mobile or chat, et cetera, the platform enables people to get more done in one pane of glass with fewer clicks, with a consistent look and feel. And that's important, especially to clinicians. Second, we enable purposeful automation, which means we take the digital sprawl and the siloed data that has consumed hospital systems these last few years post-COVID, and connect these pieces through our intelligent automated system of action, where we take the burden of manual work off your employees and drive real and measurable outcomes for your on-stage and off-stage employees. This drives efficiency and it reduces those costs. And third, we provide an organizational agility with our low-code enabled environment to be able to pivot and adapt and adopt new functionality quickly, allowing for more complex and unique problems to be able to be solved at speed. And on top of our platform, as you can see, we have pre-built workflow solutions. And these are intelligent and easily configurable workflow orchestration solutions around common work areas such as customer service, human resources, and IT. But we can do all of this because of our unique core foundation. Everything is built on one platform with one architecture and one data model, which simplifies upgrades, acquisitions, and adoption across the entire organization. We also have an industry data model extension specifically for healthcare provider organizations. And we support FHIR as our industry standard for interoperability. And we meet HIPAA security rule standards. I get asked this all the time, as well as we map to high trust standards as well. So streamlining workflow and processes is what we do.
So I guess, the notion of the ticketing system, because that's kind of what I knew ServiceNow as before I drank the Kool-Aid and understood the notion of the platform. So we've very much grown outside of IT and the notion of enterprise service management, right? And through our industry verticals, we have clinicians, physicians on board that are actually helping drive the solutions in terms of where we need to focus. It's very key for us. And we are workflow automation. So, some of the other areas that we looked at were things like automation of manual processes, right? When I think about this, I think about, when I visit my own healthcare provider, I get this clipboard that, I have to sign and fill out all of the questionnaires, and then I hand it back to that poor person who's then going to take it and like hack away into the EMR all of this information, and then perhaps the thing needs to be like faxed or put in somewhere. And I feel frustrated, and I feel sad, and I feel like, you know, opportunistic, just because that's a very small area where you can literally give time back, right? You can invest the time up front in actually coding that questionnaire pre-visit, and then you get, you know, I get it sent. It's all in there. There's an interface that takes it to the EMR so that the PA or the physician can see my information in the EMR, rather than having this intermediary who's just doing that. And so I feel like this notion of like automation, like what is it, right? Well, there's different aspects of it. There's like robotic process automation, the use of bots as a substitute for humans in routine, error-prone, high-volume manual processes. Claims, thousands, millions of them, right? Mm-hmm. There's a stat out there: for every 1 million claims, there's about, 250 people that have to be there processing them. And it's like, well, that's really a very repetitive workflow that could be more automated, so that perhaps the claims people can focus on fraud detection, which actually incur a lot of costs, right? That's a lot of high costs in the healthcare system. And it is so fragmented that fraud can be anywhere. AI, and what is this notion of AI? Bringing in that data and the analytics to try to see who are my frequent flyers to the ER that usually don't have a very acute condition. Is there a way for me to marry different inputs so that I can actually try to change the behavior of a person to have a different output? And that is where AI comes into play. It is not just technology. There is a human intervention that has to be there that actually makes AI work better. And then from an automation engine standpoint, so ServiceNow has this notion of it's a platform, right? Like the way that I think about platform, when I got interviewed for ServiceNow, they're like, what is a platform? And I was like, well, it's kind of like a sandbox, right? I have a sandbox and I have sand, and then I can go build sand castles and I can build moats, and you give me the opportunity to do that. And so that's the way that I think about this notion of it's a platform for creating workflows. And the workflows could be end to end. It could be across your enterprise. It could be from your procurement to your HR to your clinicians to supplementing the EMRs. And we'll talk through that a little bit more. And then this whole notion of hyper automation, which is this fancy word for bringing all those things together so that you can actually automate and optimize business processes. We have a use case with what we're doing in Norway with Helse Sør-Øst, which is the university hospitals for Norway. They have a challenge. Their challenge was they faced a lot of canceled surgeries. And so what we're doing with Norway is to actually help them understand through the use of AI and ML what surgical theaters there are, what devices are in those rooms, which marries to what type of procedures can happen in those rooms. Then we've taken the rostering of staff to say, how do you get to optimal utilization of that surgical theater and the actual employee or clinician? And so in there's all the algorithms and the analytics, and then you're able to get to a point of utilization data to say, at the time where we have, this is the most optimized schedule. From there, you have patient engagement, text messages, 10 days out. Are you going to come? Yes. Okay. Fill out this questionnaire. Are you still coming 5 days out? Yep. Okay. Go pick up this prescription. Here's the information your caregiver needs to be able to take you home. That is the use of a workflow to bring in different parts of information together to get to better outcomes.
And the experience to, the patient is seamless, right? And possibly on the clinician side as well. Absolutely.
Yeah.
All right, I'm going to take the next two because they kind of fall together. They really go hand in hand when you talk about decreasing the number of systems that the clinician has to interact with during the day, which are many, not just the EHR, but there's hundreds of clinical ancillary solutions that they work with. And you talk about the IT portfolio of applications and systems and rationalization. with strategic portfolio management and application portfolio management, just two of the products that we have, owners have been able to create and manage service offerings and portfolios, including the ability to rationalize or reduce applications. So here's where we can actually put the system to work for reducing costs. And I love to do these workshops. Many of our architecture teammates offer these workshops for our healthcare organizations, and we can sort the applications. A lot of times they just don't even have an inventory of all the different applications. There's been, during COVID, it was the Wild West, right? So just to stay afloat, a lot of units, a lot of outpatient organizations, they went to buying whatever suited them at that moment just to survive. So there's applications out there that could be causing security and risk problems to the organization as a whole that the IT team or the strategic portfolio team does not even know about. So we can do a great overview of inventorying the applications. We can categorize them by cost, risk, duplication, business value, functional fits category, and help the customer be able to see what can be migrated over to the platform that they already have, to streamline those experiences and, not only cut another application that their employees have to deal with, but they can also cut some costs out of the system as well. I've worked with customers that are dealing with 2,000 to 3,000 siloed applications. And a lot of those are small to mid-size healthcare organizations, very hard to not only maintain, but secure those applications. Security is a big part of app rationalization as well. As an example, Wellstar had a similar challenge. They wanted to have a single source of truth for their applications. They wanted to manage all their IT information and applications so that they could assure availability and security of their clinical documentation. We all want that. Through their SPM adoption, they saved over $500,000 in annual costs relating to the transformation of IT data and insights. So that, that's real money.
Yeah, absolutely. And it's proof points, right? That whole notion of value, return on investment. This thing about reduced time and approval cycles. Anytime I hear the word cycle, I'm just like, workflow it, right? And so the way that, some of the things we can do in terms of just getting the manualness out of like step one, somebody has to approve it, like ordering a laptop. Like if I need a mouse, I don't need to go to my manager and be like, hey, I need a mouse. Like, trust me, I really need a mouse, right? I'm not. So there's this level of automation and autonomy that needs to go hand in hand in order for you to make this notion of reducing times and approval cycles. Now, when you take that to an nth degree of, diagnoses and approval for certain, let's say, medical equipment, again, for the most part, those processes are pretty fleshed out. And why not be able to actually use automation to pinpoint there's a 10-step process in order to get that defibrillator into the home? Step 2 requires 3 different systems. Connect those things. Get a platform to actually show you the workflow, and then to actually see where you are at in the process and give others the visibility too, because in these processes, apart from actually doing the step, then there's the communication of who's on point next or who dropped the ball, right? And so some of the examples that we have here are like St. Jude, for example, always looking for, ways to push the needle, even in the smallest ways. And so they were looking for a quicker way to actually pay service invoices for teams for these recurring services that they had. And so they worked with us. We basically went in and saw that they had manual labor intensive processes. We pretty much helped in terms of building out a process for their contract management. And they were able to reduce their invoice tracking activity from like 40 to 80 hours per month to just about 13 hours a month. And that's a lot. I mean, that's a huge percent that those administrators are doing something else. The same thing with like, I honestly don't know why there's any need for a wet signature in healthcare anymore, right? Like digital contract signing, that's all day. You could do that. You have a document, digital signature system, or we have it natively. Just sign the documents, go to the next step, whoever needs to sign it next, and it should be automated. And at the end of it, the patient should get a copy, the clinician should get a copy, or it should get stored in the system of record. And so, that notion, again, same thing with St. Jude, they were able to pretty much in 4 weeks develop and deploy a digital contract signature solution. They onboarded like 41 departments. They've signed, thousands of contracts to date. Again, faster time to signature, single system of record, and support for those remote employees who, don't necessarily need to be there to sign things by paper anymore.
Absolutely. Great points. Great points. I'm going to move on to more self-serve processes for clinicians. First of all, how great is it? I mean, this is what every organization hopes for, that there's a push for self-service, right? Because that means in general, lower costs. Let's see, I don't want to hurt our customer service friends, but it could be a better experience for them depending on how much of a hurry they're in, right? So they could get to the information they need at the time. And clinicians want this self-serve process, and they want processes that are seamless and easy and available where they are, right? So are they at the bedside? Are they at home and they need to do their schedule? Are they at a portal? Are they at a training event? They move around, they want the self-serve where they are. So whether it be onboarding or precepting or requesting support in the care environment, or finding the information they need, self-service is what we need to streamline. I work with several organizations, several larger organizations that are working on the concept of enterprise knowledge management. And this falls in here because we put these great portals up, but sometimes we can get an excess of portals as well. There's an IT portal and an HR portal and a customer care portal, and maybe there's a portal for scheduling and things like that. And it can be, it's hard to garner adoption when we have an unlimited amount of portals. So we're working on this unified portal experience for our clinicians, where they have a one-stop shop where they can enter in a guided chat and cross over the content repositories of IT, HR, and clinical operations, and also clinical pathways, right? So of course the adoption is going to be high because it's a one-stop shop. And that's what clinicians are looking for. As an example, Sanford Health, they adopted our employee portal to drive engagement for self-service guided journeys, knowledge management as well, and task management. They wanted that all in one place. And they were able to deflect 90% of employee requests. So that's quicker time to resolution and less stress on the HR and call center. So universal portals are, and digital front doors are that one-stop shop for our in-house and out-of-house communities. So for our clinicians as well as our patients, a good place for all requests, encouraging adoption, simplifying the front-end experience, which saves time, saves money, saves frustration. So definitely some good opportunity there.
Yeah. And then in terms of, I totally agree. Lots of, and even with onboarding and such, right? In terms of the patient view of it, the notion of like a digital front door, and yes, while EMRs have digital front doors or patient engagement mechanisms, they're sometimes not customizable to really help a patient navigate through your healthcare system and different programs that you might offer. Yeah. And so, I think that there's some notion in terms of self-service capabilities there. We have also had things like being able to just be agile and how quickly you stand things up, right? With the pandemic, the ability to it was a mess when patients were trying to actually schedule appointments for getting the jab or to actually get tested.
Right.
And so sometimes you don't want that load on the same framework as your health records. And so being able to have an agile environment to where you can quickly stand up things like scheduling appointments for vaccines whenever the next big thing happens, the ability to have self-service for patients is key as well.
Absolutely. And jumping right into scheduling. So flexible scheduling systems. Scheduling is an area where we've had great traction with workplace scheduling and field service scheduling. We're seeing clinician scheduling workflows as an area of innovation that is really blossoming with some of our customers, and we're working with them on that. So the ability to self-schedule from the clinician point of view, to do that self-scheduling a month ahead of time, to do those shift swaps, and then have that schedule route for approval in an automated fashion. In addition, through AI and automation, we're looking to produce templates, intelligent templates that help nurse managers pull fair and compliant schedules. This is where the rubber hits the road. So these templates can consider such things as union requirements, seniority rules, weekend commitments, on and off holidays, and more. So stay tuned in this space for scheduling.
Yeah, scheduling has come up a lot in these conversations we've had,
Absolutely.
Erin. I think the other thing that has come up is like virtual assistants, not only just for patients, but for employees as well, and the use of chatbots. Like at ServiceNow, we have great chatbots. I just want to know when the next PTO is, and it gives it to me, or I need to up my credit card limit, and it's a trust based on the autonomy. It does it, or it says, hey, you have to fill out some other type of form, right? So this notion of engagement through the use of technology, like no longer should you have to call a call center and waste that time to figure out where's the closest location to something, right? You should be able to say, and in some instances, think about referral management, right? If there's a referral that's coming in for me to go see a radiologist, I should be able to interact with the chatbot to say, I have time over the next 2 weeks. And then the information should say, okay, she can see these radiologists that are part of her plan. Here's the ones that have openings over the next 2 weeks. And it should be a little bit more seamless for me rather than me having to call someone to go be put on hold, to go contact somebody else, and then, eventually get a text reminder that I'm having to. So it's like, it's omni-channel to the nth degree. And I really just want to have one place where all this is happening. So yeah, Gen AI is another great use case for virtual agents and the ability to get the information, package it in a way for clinicians. Going back to that neonate policy, right? How do you actually do the work? Being able to get that right from the EMR, very key. Walk me through the steps. Those steps are already documented. It's a workflow for us.
Mm-hmm. Absolutely. Great points. Automated alerts to ancillary departments. Okay, so we take care of this through a feature we call EMR Help, which is an amazing tool. It's one of our most popular features in healthcare. We're lucky to have a trusted vendor relationship with Epic, Cerner, and other EMRs to be able to add ServiceNow to the toolbar in the clinician view of the EMR. So from here, clinical staff can quickly launch a prompted chat window to report an issue with the EMR, such as, I can't pull down the right field for this particular patient. I'm not able to enter a certain value, or any technical device issues that are going on at the time. This is a very easy adoption, and we see organizations really taking this and running with it. They're building additional back-end service management to be able to bring all aspects of the EMR into service management. So in addition to the IT-related use case, a nurse could put in a request to the pharmacy saying the wrong med was sent up, or to the lab that they don't have the proper tubes for a blood draw. So really expanding this out to cover all the different elements and departments covered under that EMR. So exciting use cases. We have I'm working with 2 large health systems in the Northeast. They're doing just this. They're simplifying tasks at the bedside. through this easy integration with one pane of glass entry into the EMR so the clinician can return focus quickly back on the patient.
Nice. And speaking to that point, the ability also to document like device issues, because we've also extended into things like clinical device management, which was the last one about inventory tracking. So we've always been in the business of tracking laptops and assets, and we've extended that to clinical devices so that we can do everything from inventorying that device to deploying it, securing it, putting a wrap around it for compliance, understanding the recalls that might be from the manufacturers, and servicing that device to decommissioning it. The ability for us to do that end to end is key in that, we're also working with the life sciences device manufacturers so that you get a full life cycle management of that device from a manufacturer side and then from a customer base as well. We have different customers we're using. CHOP is using us for the device tracking and the maintenance aspect of it as well. And so I think that, we've kind of gone through various aspects of the solution space and what we can do in the space. I think, Erin, like some of the questions just around how do you tailor these solutions to your organization? We went through a lot. Right. And we know we went through a lot, but then I think it will be helpful just to hear your point of view from tailoring these solutions.
Absolutely. So there's a lot of power that comes out of the box. But the best part about being an architect here is we work with you and your team through workshops, in design thinking sessions and process automation work groups to develop innovative processes that both solve your business needs as well as reduce that operational cost. So call on your account team and ask for some architecture help.
Nice. And then in terms of, just some practical strategies, right? So as you take this information back into your organizations, like change sucks. Like there's no better way to say it, right? But you have to be able to gain that buy-in from your leadership. And what we've seen successful is when there's a true partnership between the clinicians, the IT departments, and the organizational leadership that is actually wanting to make the change. It's not just about the money and the investments. It's truly about this notion of there's lots of competition out there. Patients will go to the next hospital. There's lots of competition. Nurses and clinicians will go to the next hospital, right? And so how are we able to promote that collaboration and care coordination? And in some instances, you have to have a partner, an organization that's going to help you innovate and think outside the box, right? We work with so many companies outside of healthcare to where we're taking those types of solutions and bringing it in here. And then from the standpoint of Erin, organizations that are still a little bit more siloed, like what have you seen work?
So engagement across IT and clinical operations and informatics. I'm a strong proponent for the informatics team. Was one team I was a part of in healthcare as well. So if you're starting these projects, I would start small and defined. Find your biggest pain point, your most expensive process, your biggest time waster. Identify the people and the processes and the technology involved in what you want to achieve. Ask to do a pilot project with the informatics team. Bring us in. We have many complementary teams that really want you to be successful in your journey. Once you're up and running, tackle the next issue. Document your success for leadership and tell us about it as well. More than likely, you already have a ServiceNow team supporting your IT infrastructure. So contact them as well.
Great. And so I think we have a few minutes left. Just some parting words for myself. Thank you all for listening. The fact that you're here shows that you also want to help in this notion of retaining our clinicians, reducing the administrative overhead and the burden that we place on them as patients and as facilitators of care. So it is a problem that's going to require all of us to do what we can to try to get to that next level of care delivery. Erin, from your perspective?
Absolutely. Thank you all for joining us. So through this report, we were able to see that clinicians we're leaving the bedside and leaving the field, not due to the desire for more money, which comes up often, but it's because they're not able to safely work at the top of their license at the bedside with patients due to broken systems for the most part. We will retain more clinicians when we digitally transform the environment of care. And we can do this.
So we want you to help support us. Erin, do you want to talk a little bit about just joining the conversation?
Sure. Please join us as we continue this conversation in our healthcare provider snug, which is a ServiceNow user group. We meet quarterly. If you're involved in patient care, build systems for patient care, or work in informatics, this group is for you. Please email Vishakha or myself for additional information. We hope to see you there.
Very good. Mark, are you online? Okay, maybe we'll just open it up for questions here. Let's see. Okay, it looks like we might have lost Mark. So let me see if I can pull up the questions. There was a question, Paul, my friend, thank you for having that question about the EHRs and our ability to, work with the EHRs. So we supplement the EHRs. We want to be able to ingest that information. It's on our roadmap to be able to integrate with EMRs through our data model, and then work with partners to actually help with some of that integration as well. So we have both the ability to do the third-party integrations to supplement those EMRs, and then we have the ability to actually on the roadmap, set up the integrations that allow us to talk to them directly. But as we all know, it's hard to get information out of the EMRs when you are a vendor system, right? And so we are actively taking care of those challenges right now. Hi, Mark.
Hello. And unfortunately, you lost me for a second due to a technical difficulty, but I'm back. It's magic. I want to thank you both very much. We have time for one very quick question, and then I'll help us wrap. But an audience member asks, how do you work with EMRs, or are you trying to replace Epic or Cerner? I don't think you're trying to replace Epic or Cerner, but whoever would like to address that.
I'll jump in there. Yes, no, not trying to replace. They would do what they do very well. We have no intention of replacing them. We have a better together strategy. So our automation and optimization around their clinical data is what is absolutely necessary in that partnership or relationship to get what we're talking about moving. So no intention to replace.
Wonderful. I appreciate that. I just wanted to say this was fascinating. You both brought up such great issues, huge issues, and I'm so glad that you brought a very, very kind of comprehensive perspective to this. And I certainly agree with you, Erin, and I so appreciate your lived experience that you shared with us. Clinicians really are oppressed right now, nurses especially. They were already the most interrupted people in healthcare. Now they're the most exhausted people in healthcare. So I think anything that you all can do, as you've expressed very eloquently, to improve that equation is going to be really great. We literally have 2 minutes. I'll give you 1 minute if you want, if either of you would like to leave us with any thoughts, and then I'll conclude us.
Sure. Yeah. I mean, all I want to say is the change starts with us, right? We are on a trajectory in healthcare. COVID helped us get here. We don't need another pandemic to get us to the next echelon of where we can be in healthcare. So it starts small. We need to just all commit to it and get us to this notion of achieving value-based outcomes in healthcare. We can do it in partnership with you all.
Wonderful. And unfortunately, that literally is all the time we have. They're about to cut us off. But Vishakha and Erin, thank you again for today's excellent webinar. Thanks to our friends at ServiceNow for making today's program possible. And thank you to everyone in our audience for joining us. We hope you'll join us in the future for another healthcare innovation webinar. This concludes today's presentation. Thank you all so much. Have a great day.
Great. Thank you.
Thank you.
Thank you.